Hi, my name is Dr. Khoi Du. I'm a laparoscopic and bariatric surgeon here at the Surgical Specialist of Clear Lake. Today we are going to be talking about abdominal wall hernia, including umbilical, inguinal, incisional, and recurrent hernia. With the advancement in technology and technique, we are able to fix these hernia laparoscopically. Laparoscopic surgery gives us the ability to do the surgery to small incision with the camera, and it helps speed up recovery for patient. Laparoscopic surgery also helps minimize pain level, recurrent rate, wound infection rate. Most of these laparoscopic hernia surgery take about 30 minutes to an hour, and they typically done at an outpatient setting. Most patients can return back to work within 1 to 2 weeks after laparoscopic hernia surgery. If you have any question regarding your abdominal wall hernia, please contact us as Surgical Specialists of Clear Lake.